I guess it depends on how far back the tooth is in the patient's mouth. Typically, wisdom teeth a little bit more of a recovery time than teeth that are a little further forward. As you get further back in the mouth, we have more and more roots. Front teeth have one root, teeth in the middle have two roots, and ones in back have three. And then, compounding that problem sometimes can be that a root might be very straight in one person in one particular area, and another person might have very curvy roots. So those create more difficulty with removing and sometimes having to go get it. And if you've got to do that, sometimes the patients have a little bit longer recovery time, but literally in dentistry, a week. It's a couple of down days. Take it easy. Don't do anything crazy for a couple of days. Don't go, ride 100 miles on your bicycle. Take it easy, and then after a couple of days, the big issue is when we take things out, we damage blood vessels and arteries. And so what we don't want to have happen is for all of a sudden the patient to begin bleeding, because one of the most important thing in the healing process is to form a blood clot. And it needs to stay in place so that tissue can grow over the extraction site and can heal properly. If we get our heart rate up and our blood pressure goes up, and all of a sudden those vessels that we damaged, that were beginning to heal and seal themselves off, pressure goes up and you blow a seal, then the clot can come loose, and that's when you start talking about dry sockets and all those kinds of issues that some people can have.